Hello, and welcome to the Kansas State Employee Health Plan Open Enrollment System. The purpose of Open Enrollment is to give you and your family a chance to review your health insurance plan and make any changes that you feel you may need. To help you in this process, the Kansas Health Policy Authority has produced this series of instructional videos. These will give you some basic information about how the State Employee Health Plan works, the options available to you, and how to go about selecting the best plan for you. In addition to these videos, KHPA is also conducting live meetings with employee groups throughout the state. You can also find information on our website by going to www.khpa.ks.gov and clicking on the Open Enrollment icon. The purpose of this video is to help you understand how your state employee health plan operates. You'll learn about the 3 different medical plan designs available this year, the different vendors that administer those plans, and the things to consider in selecting the plan that's right for you and your family. So, let's get started. The State Employee Health Plan provides a wide range of health benefits to state employees and their dependents. The plan is also open to employees of several non-state entities, including cities, counties, school districts, and some other local units of government. The plan is known as a self-funded plan. That means the amount you pay and the amount paid by your employer are pooled, and out of this pool of funds, claims are paid. The State Employee Health Plan then contracts with a number of vendors who act as third-party administrators. The third-party administrators contract with the network of preferred doctors and hospitals and process the claims on behalf of the State Employee Health Plan. In Plan Year 2010, the State Employee Health Plan will offer 4 choices of vendors to administer your health plan. The vendors are Blue Cross and Blue Shield, Coventry Healthcare, Preferred Health Systems, and UMR, a United Healthcare company. When choosing the vendor for your health plan, it's important to look at each vendor's provider network. Make sure that the doctors and hospitals that you and your family use are in the network of the health plan vendor that you are selecting. You can review their materials on our website, on the vendor's website, or by calling the vendor's customer service center for assistance. The cost of the health plan does vary according to vendors, so be sure to review the cost comparison chart included in your open enrollment book, or for non-state groups, the one that's provided to you by your employer. Those plan costs are based on the costs, discounts, and claim experience of the plans they administer. In addition, each company offers other unique features like websites with discounts, educational tools, and health promotions. Be sure to check out what they offer. The State Employee Health Plan offers 3 medical plan designs to choose from. They're known as Plans A, B, and C. All 3 plans cover a comprehensive package of services, including preventive care. But not all medical services are covered. You should review the benefit description of each plan or contact the plan's customer service representative if you have additional questions. We'll go through the plans in more detail in the next video, but here are some of the basic differences between the plans. Plans A and B are traditional plans that provide the most comprehensive medical coverage. Plan A has a deductible, Plan B does not. Plan B offers lower co-pays for dependent children for primary care and specialist office visits. Co-insurance percentages are different between Plans A and B. Co-insurance maximums are lower on Plan A than in Plan B. Both Plans A and B will offer the Quest Lab Card, which covers certain lab expenses. Plan C is what's called a Qualified High Deductible Health Plan, which also offers a health savings account benefit. Generally, Plan C offers lower premiums than Plan A or B. It also carries higher deductibles, but your employer provides you with a contribution to your health savings account that can be used to help you meet your deductible. You should also review the Open Enrollment book for more information about plan designs and options. If you have not yet received an Open Enrollment book, contact your Human Resources Director. Once you pick a plan design, you need to review the provider networks of the vendors to determine which ones have the doctors and hospitals that you use. You should also consider the other services provided by each of the plans, and finally, review the premiums to determine the cost of that coverage. As you look through the open enrollment book and study the options available in Plan Year 2010, you should notice some important changes to the plans. Most of these are the result of rising cost of health care and the limited resources the state has available to pay for employee health coverage. As a result, most employees will see higher premiums in 2010 compared to what they're paying now. In Plan A, deductibles and coinsurance will each increase by $100 for single coverage and by $200 for family coverage. The Quest Lab Card is being added to Plan A for 2010. This is currently only available in Plan B. There are no plan changes for Plans B and C. A performance drug list has been added to the pharmacy program. We'll discuss that in more detail in the video segment that deals with prescription drug plans. The dental plan deductible will increase to $50 per person, with a maximum of 3 applying to a family. The deductible will now apply to all restorative services instead of only major restorative services. We're also including an incentive for members to get regular exams and cleanings. Depending on whether you choose Plan A, B, or C, you have a choice of at least 3 vendors to administer your plan. Blue Cross is available for Plans A and B. Coventry, Preferred Health, and UMR each offer all 3 plan options. All plans are available statewide and nationwide. Coverage outside the U.S. is limited, and you should contact the plan before traveling overseas. All 3 of the medical plans are standardized. That means all Plan A policies cover the same services, regardless of which health plan vendor you choose. Likewise, all Plan B policies are the same, and all Plan C policies are the same. You should review the plan documents that are available on the KHPA website, as well as the documents that will be sent to you in January for the plan you select. If you have questions, contact the plan customer service representative at the phone numbers listed in the front of your enrollment booklet. All 3 of the plans are preferred provider organizations, or PPOs. That means, to get the best benefits, you must use a network provider. Each of our health plan vendors uses a unique provider network. You can review their networks on our website. Each plan has a rate that is based on the costs, discounts, and claim experience of the plan, so the rates vary between vendors. All of our plans offer other services like websites with discounts, educational tools, and health promotions. Be sure to check out what they offer. When you've decided which medical plan is right for you, Plan A, B, or C, you should review the provider networks of the vendors to determine which ones have the doctors and hospitals that you use. You should also consider the other services provided by each of the plans. And finally, review the plan costs to decide which plan provides the coverage you need and the best price. In addition to selecting a health plan, you also have the option of buying additional vision coverage. Details about those plans will be presented in the next videos. So, to review, here are the basics of the Kansas State Employee Health Plan. The State Employee Health Plan is a self-funded plan that contracts with vendors who act as third-party administrators. The plan offers 3 different types of health coverage, known as Plans A, B, and C. You can choose from among 4 different vendors to administer your plan. Each vendor has its own network of providers. Rates vary, and each offers additional features such as websites with discounts and health promotion programs. You also have the option of buying additional coverage for vision care. The time to make these choices is during the open enrollment period, which runs from October 1st through the 31st. Your open enrollment book provides additional details about the plans that will help you choose the options that are best for you. If you haven't yet received your open enrollment book, you should contact your Human Resources Director. You can also find additional information on the KHPA website. Now, when you're ready, you can proceed to the next video.